Good morning, esteemed scholars, dear students, ladies and gentlemen. Today's program is occasioned by the 11th National Conference of Pathophysiology, which took place on the days between 4th and 7th of September 2019 at the University of Medicine, Pharmacy, Sciences and Technology, George Emil Palade of Târgu Mureș. The conference activities focused on topics of interest for both fundamental research and clinical pathophysiology, mainly in the fields of cardiovascular diseases, cancer, as well as metabolic and nutritional diseases. The conference boasted the presence of a number of international keynote speakers whom I had the great privilege of interviewing. Therefore, today, I'll invite you to follow the program in order to meet the great personalities in the field of pathophysiology that visited our university and find out straight from the horse's mouth about the latest developments in their area of expertise. My first guest here in the studio is Professor OLGA PECHANOVA. Dear Professor, welcome to our university, and I'm most grateful for your accepting the invitation of coming to the program.
Thank you very much for the invitation to your nice studio.
I would like to begin by asking you to let our viewers know what you do, professionally speaking, in Bratislava, Slovakia.
Okay. Actually, I'm biochemist. I finished biochemistry and the Faculty of Natural Sciences, Comenius University in Bratislava. And after many years of research, I am now the director of the Center of Experimental Medicine, Slovak Academy of Sciences in Bratislava, and working mainly on cardiovascular research.
Mm-hmm. We also know that you are the president of a very important association in the field of pathophysiology. Can you tell us a few more details about this?
Yeah, this is the International Society of Pathophysiology, and I started to be president from the last year. Mm-hmm. When the big International Congress of Pathophysiology was organized in Bratislava. And from this year started to be my presidency of this society. And we would like, of course, improve our society by growing up and also by recruitment of more and more members, also from Romania and other countries, of course.
Mm-hmm. So it is an honor to have you here.
Thank you.
You were telling the audience yesterday at the conference that you view Romania as your second home if you take into account the number of times you came here. Please tell us, how many times did you come to Romania?
When I start from the first time, you know, as a child, I several times crossed Romania because of every year holiday in Bulgaria in Black Sea. So we were crossing the Romania, and I saw that you have really very nice countryside and nice country and green country, and we never stopped there. And it was really a pity, mm-hmm. because you have very nice places and you have a lot to see. But finally, it was probably 5-6 years ago. For the first time, Professor Magda Badescu invited me to the Pathophysiological Conference in Iași. And it was really a great honor to me to participate in your national pathophysiological conference with so nice talks and many interesting people. And thereafter I was invited also to the physiological and also pathophysiological conferences to Cluj. I visited also Bucharest And now finally I'm here in Turgu Mureș, and I also appreciate it very much because I know very clever and interesting people, and I believe that we create some new cooperation probably on an international level and starting some new projects and grants.
Okay, so indeed this was my question. What is your opinion of this conference organized here? So as far as I can see, it has been a very effective visit to Romania this time. So it wasn't only about delivering a talk, it is also about connecting with people working in the same field and creating opportunities to cooperate.
Of course, because as I was able to listen from different lectures, we have many similar topics, we have the similar methods, and when we join our forces in the research, we can also have better results, because we can combine our methods probably on the level of molecular biology, on the looking for structure of different tissue on different levels. So we can work on a higher level and then also produce the better results which could be very well accepted in different international journals. So that it would be my pleasure to start cooperate with Romanian colleagues in different projects and grants.
And hopefully many of them will be from this university.
Of course,
and
yes,
from this medical center, because Târgu Mureș is one of the most renowned medical centers in Romania.
Yes,
can you tell us now a bit about your major field in research and your major field in medical activity? What are you currently studying and trying to achieve?
Yeah, so I'm focused mainly on cardiovascular research, and from cardiovascular research we try to improve or develop some new drug for treatment of cardiovascular diseases. And we were focused on hypertension, on high blood pressure mainly, and to see how we can prevent the increase of high blood pressure, and when somebody have hypertension, so how we can treat this without so many side effects. So, but now it is not only hypertension, but we also study the myocardial infarction and looking for preservation of heart before infarction, and also treat it after this period, or looking for the drug for heart failure. And so this is the main research, and as I say, also looking for new drugs and for new therapies, including also natural therapy.
Mm-hmm. That's great news. I checked the program, and I noticed that the title of your presentation is Novel Tools for Affecting NO Signaling in Metabolic Syndrome. Is this paper connected with what you have just mentioned in terms of your interest in research?
Yes, of course, exactly. This is about the statins. This is the drugs which are normally used for decreasing cholesterol level in obese patients. And these drugs may protect even the life because of decreasing cholesterol. However, at the same time, they have also many side effects. And among the major side effects belong the weakness and the decreased possibility of movement, because this drug decreases also coenzyme Q, which is responsible for synthesis of ATP. This is the energy product. So in my paper, I was focused on improving this drug for a better targeted therapy. And with this aim, we loaded simvastatin, this is one of statins group, on nanoparticles to ensure more targeted therapy and to decrease side effects of statins. And we were able to prove in our experiments that such nanoparticle-loaded simvastatin had much more better effects comparing the normal powder simvastatin. So that was one part of my presentation. And the other part was about these natural substances which are able to decrease cholesterol level also and also improve some pathway which are necessary for living. And among these natural substances was also the extracts from different wines. Also this is non-alcoholic extract. And some polyphenolic compounds from the wines have also a very good treatment effect and also protective effect.
Wow. This is, you know, natural remedies is a very interesting approach by a medical professional. I guess it's going back to some, I don't know, fundamental knowledge and very old knowledge maybe, or not necessarily?
Yeah, but you know, among the patient are many those which are intolerant to several drugs.
Okay.
Among them also many patients intolerant to statins. So we were looking for some alternative treatment. This is, yes, something like alternative, even not so effective like statins, however quite good as alternative therapy.
And my last question is somehow personal. I am not a patient with heart diseases, fortunately, but can you give us some advice on what to do to maintain our health, especially when it comes to heart and blood and circulation? And
yes, as we scientists say, the best drug is the prevention.
Prevention.
And also the healthy lifestyles. That means a lot of physical activity.
Okay, so working out.
I'm a very good example because previously I have no physical activity. I just sitting and writing the scientific papers and to work under the computer. And I was ill 4 times every year. And then I start to run every morning. And I run from 5 to 6 kilometers every morning, and from that time I haven't been ill. So
okay, so
but
this was tested by
yes,
first hand. Yes. Thank you very much for this advice. I'm very grateful for your coming here. I have to state this once again, and for sharing your knowledge and your thoughts and your experience.
Thank you very much for the invitation.
And we are looking forward to having you here at the university again.
Thank you very much.
My second guest today is Dr. Andre Rothman. Welcome to the university and welcome to the conference, Doctor.
Thank you.
I would like to begin by asking you to tell us a few things about yourself, please.
It is an amazing day for me today because I was born in Romania, actually in Bucharest, in the capital, and at the age of 9 I had to leave the country, and I grew up in Germany, in Frankfurt. And so I studied also in northern part of Germany and in Frankfurt also. And I became a gynecologist and obstetrician. So till 24 years I have a big private practice near Frankfurt with some employee doctors too, and we make a lot of normal gynecologists, but my special work is the gynecological oncology. And so we make diagnosis and treatment even with chemotherapy. And my interests are mostly on a holistic way of treatment of the patient, and so we use complementary oncology. So not instead the normal school medicine, but additional compounds from natural medicine and techniques like acupuncture and also yoga. We use different kinds of complementary medicine, and so in the last time we saw that some natural compounds could be a good help in the therapy of breast cancer. This is the most work that I have breast cancer patients.
Yes, I noticed by reading the program that the title of your paper is Breaking News from the Field of Complementary Oncology, an existing presentation of new integrative therapies in breast cancer patients. So it is exactly what you were telling me just a few seconds ago. Can you give us some more details about this research? Are you optimistic in your research? Can you come up with some good news? The breaking news is good news.
Yes, so breaking. I am always a very optimistic person, but also I want to make it on a good scientist level and scientifical. And so it was a very interesting research that we did. We saw that curcumin, like curry from India, for example, you see that the people in India or Pakistan that eat a lot of curry, they have different kinds of cancers than the people in the western part of the world. So in Germany and in Europe, for women, the cancer number one is fortunately breast cancer, and for men should be also prostate cancer. And in India, it is not common, these two cancers. Mm-hmm. So we saw that curcumin could be related to this, and but curcumin is not water dilutable. So it was a new compound that made curcumin possible to take it by IV infusion. And then we made one of the first study, a double-blind randomized study with 150 patients with advanced breast cancer, and the half of them, we gave them curcumin plus chemotherapy, that is taxane, it's paclitaxel, and the other one, they get the taxane with placebo. Mm-hmm. And then we saw how they do after 12 weeks of treatment and 12 weeks of aftercare. Mm-hmm. And very astonished we were when we saw that the tumor shrinking was very high, significant in the group that get curcumin when you compare it with the group with placebo. Mm-hmm. And what I was very happy to see that the side effects like fatigue, that means when you are tired and weak after the chemotherapy, it was significant lower level in the curcumin group than in the placebo. Mm-hmm. So the people feel much better, and the tumor shrinking is significantly stronger. So this is a pilot study, it's a small study, but we hope that it will be initiating bigger studies that can show that you can combine curcumin IV with normal therapy like chemotherapy to reduce side effects and make a better quality of life. That would make me very happy.
So you found this natural remedy
Yes.
for treating, we are talking only about breast cancer here,
Yes,
so for
yes.
treating breast cancer, but you only propose a combination between the conventional treatment
That's it.
and this natural remedy.
It's exactly what I mean.
Otherwise, it wouldn't work. I mean, just to tell women you are going to be better without really treating them with the chemicals that are the classical treatment and so on, that wouldn't work.
This we don't know
We don't
exactly,
know.
but we suppose also, we know that curcumin works very good by arthralgia, so joint, we know that it works by different kind of arthrosis. So,
Okay.
and also chronic diseases of the chronic inflammatory diseases. We know
Okay.
it. So it works alone. But in cancer, I think that curcumin can prepare the cancer cells for targeting with the with a compound that is, in this case, was taxane. So it's like a chemotherapy. So together, I think the effect could be very good. But to prevent cancer could be an idea, perhaps also to consume perhaps curcumin or curry, and also to live a good life, for example, to be lucky and also another
to be happy,
happy.
to be a happy person that
Yes.
tries to avoid negative feelings and
Yes.
also work out, as Professor OLGA PECHANOVA recommended.
Yes. This was also a part of my presentation. I showed another study that showed that when you make more physical activity and change the food to more vegetables and fruits, it could enhance your situation and make a better situation. And also for already ill people, they have a better prognosis. And also to avoid weight gain, to adipositas. So not to eat too much. So I showed in my presentation some data from Japan, a certain island which is called Okinawa.
Okay.
And there are the most, it was a time that there were the most people more than 100 years old. And their thing is they eat about 80% of the food. They don't eat 100%, not to be too full. So, and I told also a Japanese word, which is called hara hachibu. I don't speak Japanese, but it's
You found this
so-called
term and you are using it.
Yes, and I told the people that's interesting to change the food, not too much. Also, the proteins that they have it more from fish, and not too much carbohydrates, and not too much salty, and not too much alcohol.
Okay. So a healthy lifestyle is,
Yes.
is very important, both for preventing diseases and for
That's it.
keeping them under control if something, if a diagnosis
Yes.
is given.
You know, when the people get the diagnosis cancer, they are, of course, very sad. But the first thing, they think, what could I do as a patient to get better? And if the other oncologists, they think, don't worry, I will do something for you.
Yes.
But the people want to do themselves, to help themselves to get better. So I think it's not bad to think about the food, about the style of life that they did, about the stress that they had till now. And I think meditation and walking, physical activity, and changing of food to more natural compounds and biological compounds could help. Also for the psychological factor, that they know now I'm doing by myself something about the cancer, and so even it doesn't work every time, but they have a good feeling, and a good feeling is always good.
Yes.
For the doctor, but most for the patients.
Yes, I believe that if they make such decisions, patients start to take control, right?
That's
they take
it.
control of their life, and then
Yes.
they feel and they also become more optimistic, probably.
That's it. Yeah.
And they increase the quality of their life in this way.
That's it. Just to see every second that you live, to live it full.
Yes.
And so you have more quality of life and more density in your life, and so the life doesn't go away without feeling it, but it's more full of density. And I hope also to try to be happy.
Yes. And it doesn't matter how long you live, what matters is what's the quality of the life that you lead.
That's wonderful. I could write it on my practice, what you told me.
Thank you very much. My last question is connected to the conference.
Yeah.
Is this the first time you come to Romania after leaving at the age of 9?
No, actually I came sometimes, also in my birth town, Bucharest. And especially I love the mountains, and I love Transylvania, and I came sometimes in Sibiu, and Sibiu, it was very nice, and there also I celebrated my birthday 3 years ago with some friends from Germany and family, and it was amazing at that time. And so, but I spoke to Professor Kotoi, who's the dean of the university, and he invited me here, and it is actually the first time in Târgu Mureș, and I am so fascinated about the people, about the area, and about the university. And mostly I'm fascinated about the organization of this Congress. You know, I am in a lot of big Congress, also the biggest Congress of the world in USA, but this organization and full of good feeling and with heart and personal helps, it is unique, and I can recommend every man in medicine to take part in this in a conference in Romania, and I am happy to come again.
Okay.
It's really wonderful.
Yes, it would be wonderful to have you here again. Thank you for this interview.
Thank you very much.
And good luck with your research. And indeed, the result of your research is indeed good news.
Thank you very much.
The third guest of the program today is Professor Zoltan Sauvage. Professor, welcome to our university and welcome to the conference.
Thank you for the invitation. I'm very glad to be here. So it was actually a surprise for me getting an invitation, taking part at this conference. maybe you have to know that there is an old friendship between Ovidiu Kotoi, the dean, the decan, and myself, since Dr. Kotoi spent several times in Budapest just 13 years ago. So our friendship started at that time. And we had some, actually some common topic, common work, which was connected to the heart transplantation. So that's why it's a privilege to get an invitation from Dr. Kotoi to come here.
Yes, and we are very lucky that this friendship exists.
Absolutely.
Yes.
Thank you.
Could you please tell us a few words about yourself? I mean, what you do professionally?
Yes, I'm actually I'm a real surgeon, so I'm not a research man. I started with general surgery in the late 17th, and then I became a vascular surgeon, and finally I ended at the cardiac surgery field. So I started almost 40 years ago my surgical career, and after a while, or in the meantime, the Heart and Vascular Center of the Semmelweis University, which is actually at the very moment 250-year-old. So there is an anniversary of the university. And this Heart and Vascular Center started to build up a heart transplant program. And as a young cardiac surgeon, I was involved in that program. And maybe you heard about that 27 years ago was performed the first Hungarian heart transplantation. And this guy, who was at the time 29-year-old, end-stage heart failure young boy or young man, survived this procedure, and he is doing absolutely fine even nowadays. And then it was a long story of the Hungarian transplant program, but finally we joined to the Eurotransplant just 7 years ago, which made a real effort and activity to our program. So this fact that we could join to this Eurotransplant made a triple of our cardiac surgery activities. So nowadays we perform annually more than 50 heart transplantation, which is not too bad. This means that within Europe, or within the Eurotransplant, Budapest, the Semmelweis University is the second biggest heart transplant center, and the institution, the clinic, is within the first 10 center all over the world. So maybe that was one of the reasons that I was invited to this conference.
I'm sure, because you are, after performing so many transplantations, you are an expert in this field. Is this your, I believe this is not your first time in Târgu Mureș, right? You came here before. You probably also attended conferences in Târgu Mureș, am I right?
Yes, absolutely. So maybe in the early 2000s, I was invited here for the first time by Professor Serestum Lajos. He was an old professor of this university, to offer a cardiac surgery course for the Hungarian students. So since that time, I used to come here once a year to offer 4 or 5 days long course for the students. So that's why came home like Târgu Mureș would be my native city.
Yeah, so you are very familiar with this?
Absolutely,
town
yes.
and with the region? Have you traveled in the region?
Yes, I know very well yes, I
region.
had a lot of time to know, to visit the region. It's a beautiful one. I like it.
Thank you very much. Now coming back to the conference, I noticed that the title of your talk is Heart Transplantation in Hungary, Past and Present. Can you brief us about the conclusions of this study that you made, which I imagine it's a very complex one, and it is based on first-hand experience.
Yeah, thank you for the question. So, in the past, maybe in the first decade after starting our program, the situation of our program was very, very similar to that which is now here in Targumures with cardiac transplantation. So we performed only sporadically heart transplantation, like here in Targumures. And then I wanted to point it out through my presentation. How could we change our mind? How were we able to make further, quicker steps, making bigger effort in heart transplantation? So I wanted to point it out, giving a sample for the Romanian colleagues. What should they do to getting better results or having bigger activity on the field of heart transplantation? So it's not easy. It's not easy. So I wanted to point it out that what were the main steps, the main key point in our program, fulfill the waiting list, then create artificial heart program, and it was basically important to join to the Eurotransplant. So maybe it's a receipt to our colleague here in Targumures.
Yes. The work that you do is very important. It has, it has impact on the life of the patients. Do you find satisfaction in the work? I mean, when it comes to the meeting patients after the transplantation took place?
Yes, absolutely. For example, last week I spent a couple of hours with transplanted patient. So there was a club session for those, and maybe two dozen operated patients were attend this club session, and they were transplanted 21 years ago, 16 years ago, 15 years ago, 10 years ago, and so on. And I remember that these people, these patients, were in a very, very bad cardiac condition before the transplantation. So they were in really end-stage heart failure. And now they are running an active life. Yes. They are making sports. They have a lot of fun, and they actually have a beautiful life. So yes, this is the impact. When I see such examples, then we are fulfilled with adrenaline, and we are happy to go on with this program. But back to our program, the first transplantation was performed 27 years ago, and the guy who underwent that procedure at the time, he is living with the same second heart, and he's active, and he was married. He has 2 kids. Wow. He has a job which he never had before.
Yes.
And he got 27 years with this successful heart transplantation.
So you gave this man his life back, and you gave so many people their life back, and I'm sure that they started appreciating and loving life after this transplantation.
I'm sure you are right. The majority of the patients are happy, and they are healthy people.
Yeah.
So they are not anymore patient. So are active patient running absolutely active life.
Yes, you must be very liked and admired as a doctor doing miracles, simply miracles.
Yes, you are again right. So it's a fantastic job, and I have to be thankful that I got the chance at the time to join in this program. It's a miracle thing. So I always used to compare to that fact when a small kid, a child, is boring. So I remember when I was a medical student and I was in the gynecology, and I saw the first delivery of baby, and we were standing there, medical students, and we started to cry, and it was just terrible. So it was the delivery of the life, and this heart transplantation is very similar.
I agree.
So we remove a heart from that person's chest. We put it in a other person's chest after removing the very bad heart, and the heart start beating. It's a miracle.
It is indeed, and it was an honor, because the interview has come to an end. It was an honor to have you here, sharing such experience, such large and wonderful experience as the one you achieved by working in this field. Thank you very much for being here.
Thank you very much for the invitation. Thank you.
This is the end of the program. I am Corina Lirca, and my guests today were three of the most important contributors to the 11th National Conference of Pathophysiology. Thank you for watching. Have a wonderful afternoon.